If you have herpes, your sex life is entirely over. Or that's what you might think. And in this video, I want to explain if it actually is true, whether or not you have to use condoms all the time for the rest of your life. What about oral sex? Can you still have that? And maybe you're someone watching this video who is too afraid of ever giving herpes to someone, so you decide not to be intimate ever again. And I want to do a masterclass on how to actually have sex with herpes. So the first thing I want to do is explain exactly how herpes is contagious, because that's going to set the stage for answering all of these questions as the video goes on. So how herpes actually is contagious. We're going to treat HSV1 and HSV2 the same in terms of this explanation, because they present the same, they infect the same, and they are going to be transmissible in the same basic ways, even though they're technically different. So HSV1 and HSV2 can infect anywhere on the body. Your chest, your mouth, your genitals, your butthole, your nose, your eyes, anywhere basically that has a skin cell that is going to be potentially infected. However, the places where they're predominantly found is orally on either and genitally on either. Now HSV1 and HSV2 are not location specific, so you can have type 1 on your mouth. You can have type 1 on your genitals. You can have type 2 on your mouth. You can have type 2 on your genitals. Now they're going to be passed through skin to skin contact. We have genital to genital contact. We have oral to oral contact. We have oral to genital contact. We have genital to oral contact. It's going all sorts of which ways, because herpes doesn't discriminate, doesn't care. It just wants to survive from person to person to person. And then someone out there decided to put this huge stigma, this huge taboo onto it. Now, the best way to move on from here is explaining the different scenarios by which it is contagious. Now, there are three basic scenarios when it comes to herpes risk of transmission. So we have having an active outbreak. So if you have HSV1 on your mouth and you get cold sores, that's an oral herpes outbreak. It's visible. There is a lot of virus shedding or coming off when transmission is much higher. This is something that we inevitably can see, hopefully down there, hopefully up here, wherever you have it, and avoid intimate contact. Now there's something called asymptomatic shedding, which is basically where there isn't an active outbreak that you see visibly, but there is potential virions, which is like virus, being shed off the skin. So virus is not actively visible, there's no symptoms, there could be a small risk of transmission during this time. The rest of the time, which is typically the majority of the time, the virus is fully dormant in your nervous system. I can't draw a spine here. This marker is not really working. This is just not going so well for a video. So you got your spine here, and you got your spine. And basically the virus lives, if it's a genital infection, down here, if it's an oral infection, up here. And it just sleeps. It's not contagious. There's no risk of transmission during this period of time. If you don't use a condom, technically there isn't an increased risk. But we'll get more on that later. So we have these three different examples. Now the next thing I want to do is just basically outline the shedding rate, because basically this is the assumed inevitability for human contact. Now let's write down the shedding rates. So we have HSV1 oral, okay? We have HSV1 genital. We have HSV2 genital, and we'll do HSV2 oral. HSV2 oral, that's a thing? It is. It is a thing. So let's look at the shedding rates. Let me get my notes out here. 25% of days. Okay, now this will be a year that the virus is potentially shedding, per se. HSV1 genital is about 3 to 5% of days. HSV2, 15 to 30% of days. And this over here is like 1 to 2% of days. Correct? Around 1. We'll just even take off 1. So basically, long story short, this is the amount of days in a year where the virus is possibly shedding. These are guidelines. Things that affect shedding, your immune system, the aggressiveness of the virus, your lifestyle, whether you're taking antivirals, the length of time that you've had herpes for, as well as the amount of symptoms you've had over the course of your life. So basically, the longer you have any of these, the less you shed. The less outbreaks you have, the less you shed. I can't even speak English. But these are inevitable. And it leads to my next point, which is basically the fact that the risk of herpes, while this super big fear all around the world, is inevitable. Because you have two human beings here whose HSV status may or may not be known. Maybe this guy gets cold sores, doesn't even realize it's herpes. This person never asks. Maybe this person has herpes and never got blood tested, never got any symptoms, never got any reason to know their status, and just assume that getting tested for everything includes herpes. So in this scenario, the inevitable risk for them to be intimate in any sort of way is there could be a chance of herpes. Now, could they not have herpes and be totally safe? Absolutely. But no one's discussing the topic of herpes before being intimate. So as sort of a reframe, if you're watching this video and want to sort of get more confidence, is realizing that you have herpes and you're aware, and you can take precautions with your partners, and you can be honest and let them know that you have this and let them know how you can keep safe together. And if someone's going to just blindly get rid of you because of that, they're just feeding into ignorance, feeding into the stigma, and feeding into an inevitable risk that they might encounter from the next person. Now, if you are looking for some help getting back into dating, I'm going to leave a link in the description box to a 3-step process. Once you finish watching this video, go watch that video. It's going to be how to actually get back into dating confidently. So let's talk specifically about how herpes would be potentially a risk to someone else. So we're going to say that this guy here has HSV1 on his mouth, and he doesn't necessarily have symptoms at the time. This guy over here, and we'll just put HSV negative for her. How do we, HSV negative? Sure, okay, we'll go with that. Oral HSV1. He could pass this to her mouth through kissing, through stuff like that. She's at risk of getting it here if she doesn't have HSV1 at all. This guy can also potentially be at risk of giving her genital HSV1, okay? That's basically the way that these two people are at risk when it comes to this. Now, if this girl, we'll reverse the roles now. If she has genital HSV1 down here, and this guy is HSV negative, remember how we talked about the shedding rates of genital HSV1? She over here doesn't shed very much, and if you're watching this video and you have genital HSV1, you don't shed very much in terms of the activity level, in terms of the risk of transmission. After the first year or two, it actually goes down quite drastically. So the risk of her having it here and passing it to this guy, going back to our example of being HSV negative, is quite low. It's quite low. So I wouldn't really worry too much about that. The other thing I want to touch on here, which is an important point, is that if you have a genital infection, even if it's HSV1, your mouth is not contagious. And when you kiss with genital HSV1, there's no risk. Okay, so when it comes to actually thinking about how am I contagious, don't think about the type, just think about the location you have it. And the location that you have it is where you're contagious from. So if you have oral type 2 on your mouth, for some people out there who know they have oral type 2, your genitals aren't contagious, okay? So it's all about where you have the virus, not about the specific type when it comes to contagiousness. Now, what if both of these people have HSV1? If they both have HSV1, even if he has it here and she has it here, and they meet up, the chance of them reinfecting each other, close to impossible. Nothing is impossible. I'm sure it's happening out there. But when it comes to dating with herpes, if you both essentially have the same HSV type, you aren't a risk to each other in the grand scheme of things. So for someone out there, whether you're male or female with genital HSV1 and you're afraid to date and you're afraid to disclose, a good reframe there is asking your partner, like, hey, have you ever had a cold sore? Talking about it in the form of cold sores is going to allow them to be like, oh yeah, I got cold sores when I was a kid. Everyone gets cold sores, blah, 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 blah. Everyone's got it. I got it from my grandma. If that person rejects you blindly because you have genital cold sores, they're ignorant. And that's like one of the points that always hits home for me is like, if you have genital HSV1 and you're dating and you disclose to someone who also has HSV1 who doesn't disclose themselves, they are like the literal definition of like a hypocrite. Because they're like, oh, I might be able to give someone else what you have, but I would never date you because you're gross. We're still talking about HSV. We haven't even gone on to HSV2. But we will go on to HSV2, which is our next topic, which doesn't necessarily change that much compared to HSV1, but I think it's important to sort of illustrate both points here. And all of my markers are really, really terrible. So what I might do is just walk off of the camera, keep things supernatural, not the TV show Supernatural, but the video Supernatural, and just get my expensive ones here, which are a little bit thinner. But I'm looking a little bit thinner nowadays after being sick with no voice. Can't even make any videos anymore. Okay, so we have this, we got these two, HSV2. So, HSV2, predominantly a genital infection, predominantly passed sexually because genitals are typically associated with sexual activity. Okay, me and the boys, we don't really compare tips anymore that much, only at summer camp, but genitals are usually sexual in nature. Now, HSV2 passed from genital to genital. Sometimes, however, which is usually only in cases of like someone going down on someone with an active outbreak or an outbreak that they don't even know about, then you could have HSV2 pass to someone's mouth. It will remain HSV2. And in this case, people don't typically shed very much. I think it was like 1% of days per year. And you may never have any symptoms. So maybe you have like one outbreak, it's like serious, and then you never have an outbreak orally again. So we really don't actually know the prevalence of oral HSV2. No one's really swabbing their cold sores. Mind you, I will be like the devil's advocate and say that the majority of people who get recurring cold sores, it's HSV1. So can you still have oral sex? Let's move on to that. Let's talk about oral sex. So we got a guy here, and he has HSV2, okay? And we got a girl here. I literally just drew this picture, erased it, and drew it again. That doesn't matter. She goes down on him. You can have oral sex. The chance of HSV2 going to her mouth is not very likely, typically because, now don't quote me, but the virus doesn't really prefer to infect the mouth, even though it can. So don't have sex during an outbreak. Don't go down on someone during symptoms. But there is a chance that she can get it. And really the whole question of like, can you still have oral sex just comes down to, are my partners comfortable with that inevitable risk that exists? So it's not that anything is like on or off the table because of herpes. It's typically just like, what do two partners actually feel comfortable doing when they understand the risks, everything? Let me get my pen cap over here. So oral sex is still possible. Now, if he only has HSV2 here, his mouth is not contagious. Free for all. He can go down on her with no problem, no risk of transmission. Now, I'm actually feeling like this video is all over the place and not very concise. So if it is, please leave me a comment saying your video is all over the place. It literally isn't even helpful. And I'll try to make things more concise next time. So let's talk about genital HSV1 down there. Let's say this guy's got genital HSV1. Okay. And she wants to go down on him, yada, yada, yada. Because this doesn't shed very much, the chance of transmission is even lower than if he was to have HSV2 and her to go down on him. So when it comes down to it, don't worry so much about oral sex. Have a discussion with your partners. Tell them the facts. Tell them the shedding rates. Discuss things like that. Now, if you want to use a condom or you want to use a dental dam, you certainly can. But oral sex with a condom, kind of weird. Dental dam, never seen one in my life. Pen cap flying all over the floor. Okay? It's going to be, this pen cap's going to have herpes soon if it's not careful. Now, what I did not cover is transmission rates, which I will go to in right now. Transmission rates. The only study that I have seen was a complicated Google image that basically said that for genital HSV2, which is typically the most studied transmission rate because it's the most, I guess, prominent in terms of wanting to know, male will do this, female negative. 10 out of 100 couples, I can't even speak English, couples in a year contracted. Forgot the C there. Can't even speak English or type or write. Basically, we have a 10% risk of transmission, infected male, genital HSV2 to female. And this was no condoms, no antivirals daily, and I think it was like having sex twice a week. We have now female to male. This is positive, this is negative. This was like 4 out of 100 couples. So we have like a 4% risk of transmission in this particular scenario. So now what? Condoms. You get your condom here. Sorry. This here, M to F, a 96% decrease. So what that basically means is that they took the 10 and almost halved it to about 5%. The other way, which would be female infected male, it was something like 65% or something, which is obviously a little bit less, so maybe it's like 2.5 over here. Daily antivirals though, regardless of the person's gender, basically, is this what an antiviral looks like? Sure, daily. Basically cut down things again by half. So what that would mean is that we're looking at somewhere between like 2.5, maybe to 3, and like 1 to 3%. So these are literal guidelines. This is not gospel because like I said before, length you've had herpes for, lifestyle, aggressiveness of the virus, whether you've had a lot of outbreaks or not, are all going to change the amount of shedding, which impacts transmission rates. But in the grand scheme of things, you're basically looking at a overall risk of giving someone herpes, genital HSV2 typically, because there isn't even studies on oral HSV1 or oral HSV2 or genital HSV1, other than just like, oh, transmission for genital HSV1 goes down drastically. These are the numbers you're looking at. So it's helpful to look online, maybe find the image that is on there that explains this, so you have this knowledge to share with your partners if they think that herpes is this huge, scary risk. Now, the last point I want to cover is if you're out there watching this and you're too afraid of ever giving someone herpes, to ever be intimate with them. I want to give you a couple different mindset shifts that may help you reframe how you see yourself and how you see your sex life. So the first thing is that majority of people who reach out to me, because I unfortunately have to speak to lots and lots and lots of new people getting herpes, I love to, but I just want the herpes stigma to go away, is that they all basically got herpes out of the blue. So herpes just came and it got them. And maybe their partner, this is a gay couple now, that's okay, we're trying to be inclusive here. Maybe this guy had no idea he had it. No idea he had it. Or maybe he knew he had it and cheated on them. Or maybe he lied. Or maybe he was too afraid to disclose. And this is oftentimes harder to handle for this person than it is for someone who is told upfront about the herpes. And the reason why I want to make this clear is that you are arguably a safer partner in today's day and age with the inevitable risk of herpes transmission here or there than someone who doesn't even know their status. And there's so many points that lead into why someone may not know their status. Lack of testing, thinking it's more severe than it actually is, never having symptoms and possibly having something come up at one point, or just thinking that like you're clean or something, or you're not I wouldn't have herpes. I'm not the kind of person to get that. Most people don't know their status. And if you know your status, you take precautions, you live a healthy lifestyle, you might never give anybody herpes. And it's a reframe to realize that you aren't necessarily so risky, even though you know your status. Now, the next point, we're going to use the same exact drawing which is, my life is over, okay? That's what this person feels. And guess what they do to sweet little Jessica over here? Now, Jessica is a lovely girl. Jessica sees a lot of value in Kyle over here, but Kyle is deeply afraid of ruining Jessica's life, even though Jessica actually totally likes Kyle. And the reason this is a problem is because we actually never overcome our diagnosis. We never get the confidence to date again. We never feel like ourselves. We always view herpes as this life-ending thing. And then we project those feelings onto Jessica, even though nobody should want to get herpes and no one should want to spread herpes. But you actually don't know whether or not Jessica is going to handle it the same way that they did. This isn't gaslighting. This isn't like, yeah, well, herpes didn't ruin my life, so it's not going to, no. But we actually end up projecting how we feel onto this person, and that prevents us from ever being intimate again, because we say, this ruined my life, at least in the short term. I could never do that to someone else. And that holds a lot of people back. So the key here is that if you're even thinking about going and dating, or you want to, or you're afraid of transmission, of giving it to someone, you have to work on reframing the way that you see your own diagnosis, because you're never going to be able to date confidently if you still think you're a burden to society. When in reality, the real burden is the lack of testing, people who lie, people who don't take precautions. So look at that and ask yourself, what is the story that you're telling yourself about you having herpes, and is it hindering you from going out there and dating? So an action plan to be as safe as possible when it comes to dating and disclosure, we'll draw a young lady here just to be inclusive again, is don't have sex during an outbreak, okay? That's a no-no, okay? The asymptomatic shedding, that's the inevitable risk we should all put ourselves at. Interesting face. Over here we have dormancy. Majority of the time, this young lady is dormant, not contagious. We're going off of basically genital HSV2 or technically oral HSV1 because those are the most active situations for HSV. Assume this could be the small risk of transmission all the time. Use condoms with your partners to get yourself back out there if you're deeply afraid of herpes. You could take daily antivirals. This will basically decrease your risk of transmission to anywhere between 1 and we'll say 5% per year. That's a pretty low chance of giving someone herpes, and it's backed up by the actual truth. When it comes to disclosure, reframing your disclosure as a mutual conversation about sexual health will then allow you to filter out partners who think it's gross or think it's disgusting or never had a conversation about sexual health before. And you may actually find that even if you're still struggling with your diagnosis, you meet someone, maybe Tom over here, maybe Tom has already dated somebody with herpes. Maybe Tom understands that herpes is out there and is an inevitable risk. And maybe Tom can actually help out young Jessica here to say, you know what, it's not a big deal. How do we keep safe together? But the how do we keep safe together part is only going to be solved. What am I saying? Basically, you got to go through the 3-step process that's linked in the description box, because the first step is getting educated about herpes, so that when Tom says, how do we keep safe? Jessica over here can say, oh, well, this is what you need to know about herpes. This is how we can keep safe. I'm doing this, and understanding that the mental side, which comes in step number 2, which is getting confidence back, getting your self-worth back, reframing the way you see your diagnosis, will allow her to not project my life is over onto Tom. This went from how to have sex with herpes to a therapy session, but that's okay. So to summarize this video, let's break it all down one more time. So to summarize, HSV1 can be oral, can also be genital. HSV2 can be oral, can also be genital. Wherever you have the virus is where it's contagious. Having it in one location does not make the other part of your body contagious regardless of the type. You can have both. That's a different story. They both apply the same principles of being contagious separately in either location. Transmission can occur oral to oral, oral to genital, genital to genital, genital to oral. You can refer back to the shedding rates in terms of the actual risk based on where you have it. So the most contagious scenarios is oral HSV1 to someone's genitals or genital HSV2 to someone's genitals. The other two versions, which is essentially oral type 2 and genital type 1, aren't very contagious, which is explained with this drawing here, where majority of the time, virus is dormant, not contagious, asleep, cannot be passed. Outbreaks, whether it's oral, whether it's genital, most amount of virus present, temporary symptoms, avoidable, don't have sex during this period of time. When you go into dating, assume that this could be the risk, okay? So there could be asymptomatic shedding based on those shedding rates some of the time, but having this exist shouldn't prevent you from living your life, because this is inevitable, and you can either go your whole life fearing the fact that herpes is contagious, even if you might never spread it, or accept this is the reality, accept this is the majority of the time, and live your life by disclosing and having open conversations with your partners. When it comes to keeping yourself as safe as possible and your partners as safe as possible, condoms decrease the risk of transmission. Daily antivirals decrease the risk of transmission, but talk to your doctor. Staying healthy, having a good immune system, reducing your symptoms, decreases the risk of transmission. Can you have oral sex? Absolutely. It is not prevented by having herpes. It's just prevented by ignorant partners. And if he doesn't want to go down on you, or you don't want to go down on him, or blah, 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 you find a new partner, because there are endless options out there just waiting to sign up because you're a baddie. And I'm a baddie. And just because you have herpes, it probably means you are a baddie. Because everyone else out there who never gets a chance to have sex, never gets a chance to get herpes. If you both have the same type, regardless of the location, the risk is very, very, very near impossible for reinfection. So oral type 1 and genital type 1 in two separate people doesn't present a huge risk. Discuss that with your partner. Condoms always, not necessarily. This comes down to the comfort level of you and your partner. Honestly, doing this summary, I feel like I could have made the entire video in 5 minutes in a summary, but I hope you liked the first part of the video where I rambled on for hours and hours and hours. Discuss with your partner what you want to do to keep as safe as possible, or also just to have fun with each other, because you don't necessarily want to feel you're controlled. You don't ever want to feel like your partner is controlling you. So if you want to not use condoms, you can offset it by taking daily antivirals. Or you can do none of those things and just live your life, as I have done, as some other people have done, because at the end of the day, if you are afraid of transmission, or you have no confidence, or you don't know how to disclose, you still might be able to find a partner who literally is like, I've already done this before. I've already dated somebody with herpes. This is not a big deal. Let's just live our life. Let's just enjoy each other, because at the end of the day too, herpes is as big of a problem as you make it or your partner makes it. Now, if you're still watching this and you do have problems with confidence or fears, or you don't know how to disclose, I'm going to leave a link in the description box as well to work with me. I'm going to hop on a call with you. We're going to go through how to actually get your life back on track and get you dating confidently. See you guys in the next video.